GSMA has been working for years on innovation in the health sector because we think there's a lot of potential to be gained. Already in Europe we can save up to 100 billion euros in saving costs for healthcare, and that's very important because of the aging populations. We see a lot of rising costs of the healthcare systems in Europe. But if we look at the practice of the outcome of these policies, it's very limited. Aging IT systems in the healthcare sector, there's a lot of fragmentation. The power of the European institutions is very limited, and then also consumers are not so eager to actually start wearing Fitbits and do other stuff.
I would like to start with the potential of these e-health solutions because they have a possibility of empowering citizens and patients. But one of the challenges is that how can we make it happen that those pilots and testing, the nice small-scale testing, we can upscale so that the whole population, that everybody can benefit from that. The second thing is that we need to also look at is that how can we ensure that the data privacy and data protection issues are taken into account. I think that the General Data Protection Regulation gives this very good possibility for providing security for everybody. And then the last thing I would like to say as an important thing is the financing. If you want to set up large-scale systems at the nationwide, that costs money.
Parliament has been from the beginning very active in the digital agenda. As you know, we have taken into consideration this mandate, and all the issues that related to the digital technology and the old available technology we have taken into Parliament, and we have made so many debates. One of the most important was the cross-border access to healthcare issues, and if you take that into consideration, the digital interaction is fundamental because patients to patients or doctor to patients and doctor to doctor relations and exchange of information is crucial.
Okay, well I think there's two elements to it. One is about building trust in the way that we use the data, and the second is really about discussing the sort of safeguards we need to protect the data. And on the second one, we need to have a European discussion, because what we face at the moment is the possibility of having 28 different safeguards in each of the member states, and that will be a real problem for research.
We are using this mobile meeting series event to discuss how we can overcome these barriers and make the health sector in Europe more digital and more mobile focused.